What's up, TRT community?
Hey there, let's help each other.
I want to make this video for two reasons. Number one, I've made some adjustments in my dosage recently that helped me and saved me some money. And then I also want to make this because this channel is becoming exactly what I wanted it to be. It's becoming a community of people that all struggle with this or are curious about this. You're subscribing, you're commenting, you're giving advice, you're asking questions, and guess what? All that is creating a community that helps each other. And so what I'm learning as we're doing that is there's a lot of people out there taking a lot of things and paying a lot of money. And so I'm just concerned and I'm scared that maybe some of us are being told we need things that we might not need and being charged money that we might not need to spend. And if you can afford all these extra things, okay. And if you are totally fine with it, okay. But I've just been getting comments of people paying like $300 and $500 a month. So when it comes down to how much you should take or what you should take, really, we need to always fall back to what our doctor has prescribed for us. This is what he does for a living. This is his job. And most of them out there, most of the doctors out there, I would say, do have your best interests in mind. And most of the people at the TRT clinics have your best interests in mind as well. But as I'm reading comments from people, I'm just starting to wonder if everybody at these places does have your best interest in mind. I just want us to be careful that we're not coming across this guy who is medical professional slash salesman. This guy.
Hey, John Smith, good to see you again, friend. Hey, come on into the office here. We got a lot to talk about, buddy. So thanks for coming back in, pal. Have you lost weight? I think you have. You're looking good. And are you feeling okay, though? Well, you're going to feel even better after you hear what I've got to tell you, okay? So your lab results have come back in. You know, it was a little shocking because your results were so low. Your testosterone was so low. I don't usually show my patients this, but when your results came back, they came back like this. Yeah, big caution sign there. That's not good. Caution, patient John Smith, low testosterone. That's a little concerning to me, okay? When I get the caution sign like that, it kind of scares me. It makes me want to be a little more aggressive in my prescription to you, my dosage to you. I'm going to start you on testosterone, okay? Because you need it. You need it, obviously. Look at the big caution sign there. Now, because I'm starting you out on a little more of an aggressive amount of testosterone, which, listen, trust me, you're going to be thanking me later because you're going to be running around and feeling all energetic again, alright? One thing that you need to know about testosterone being at a little bit more of an aggressive dose, sometimes, not always, but sometimes, it will also cause your estrogen level to increase a little bit. You may have heard of something called gynecomastia, or some people call it man boobs. You don't want those, do you? No, of course you don't. So just to be cautious, I'm also going to prescribe you something called an AI, or an aromatase inhibitor. Now, you may have been doing your research because you're a smart guy. I know you are. You may have been doing your research and also seen that as you inject testosterone, your red blood cell levels can go up too. So I'm going to also prescribe you something to keep your red blood cell levels down. That's going to help you feel awesome also. I mean, that's why you came in here, right? Because you want to feel good again? That's what I thought. Yeah. And so I'm also going to prescribe you a shot of B12. Now listen, this is something I recommend. I strongly recommend that you return to us to get these shots, your shot of testosterone, your shot of vitamin B12. I recommend that. Why do I recommend it? Our facility is so clean. Have you seen it? You don't want to be doing your own shot in your dirty bathroom, do you? Of course you don't. That'd be weird. That'd be like that guy on TRT Community. He does his shots in his bathroom. It's kind of strange, that one. You don't want to be like him, right? No, of course you don't. Because you're smart. You want to come back into us. Listen, highest quality syringes, highest quality trained staff. That's what I recommend. Because I care about you, John. Right here. We have a special place right here. I'm going to give you my card here. I want to make sure that you can call me in. Oops, that was just a little money. You can call me anytime you want, friend. You pick this up here. We don't want to lose any money, do we? Okay, so here we go, Mr. Smith. Your testosterone, your aromatase inhibitor, your anti-blood thickening pills. Lastly, that shot of B12. Sometimes guys at your age just have a deficiency of that. The fee for coming back to our facility, our clean, state-of-the-art facility, to get your shots. So that is going to add up to this cost right here. Mr. Smith, you can't put a price on your health, can you? And you did come to me because you wanted to feel better, don't you? This is just part of aging gracefully, my friend. And I want to help you with that. I want to be your best friend. Sign right here.
So thankfully, I have never come across that guy, and I hope I never do. But I did learn something recently when I changed my dosage. You know that I've been taking 150 milligrams as prescribed by my doctor of testosterone cypionate per week for my low testosterone. Now what started happening when I was on that level, that my body started to hold a little more water. I also noticed that my chest was getting a little puffy. I wasn't getting man boobs or anything, just a little puffy. So I went and got my blood checked, and I found out that my estrogen levels were elevated. My doctor put me on an aromatase inhibitor. Then I went and saw a specialist, because I've been going to a general doctor. I went and saw a specialist, and he basically gave me some options. He said, yes, we can keep you at 150 milligrams and keep you on that AI, or aromatase inhibitor, that's what that stands for. And then also we found out that after doing my blood work with the specialist, my red blood cells were elevated, not anything dangerous, so then he also recommended putting me on an aspirin. And then I asked him, I said, or could I just draw back on my dosage? Because actually, before even going to him, I had pulled back my dosage to about 125 milligrams per week, and I was experimenting with that to see, is that going to make my water weight go down? Is that going to make my puffiness I was experiencing go down? And it started to. And so I think the AI was also helping me, but I wasn't taking the AI daily. I would take it like 2 days and then take a day break, and then 3 days and take a day off. And so basically I had two options. Keep buying testosterone, 150 per week, which would also make me have to buy an AI, which would also have to make me buy aspirin to thin my blood. And the aspirin doesn't cost very much. Or reduce my levels and just buy testosterone. And that's what I've been doing for weeks now. No more AI. I don't need it anymore. I'm not taking aspirin for a blood thinner. I'm just on 125 milligrams of testosterone now that I've backed off to by my own choosing, because I've just been listening to my body. Your doctor is smart. Your doctor knows things, but he doesn't live in your body. The reason why you started TRT in the first place more than likely is the same reason I started it. I was having negative symptoms that were affecting me living normally, and I wanted them gone. I got on TRT, and they're gone. Thank the Lord for that. But if I can make them still be gone at a lower dose that costs me less, and I now don't have to buy these other things that come with a higher dose, and my symptoms are still gone, why not just reduce my testosterone lower? So that's what I've been doing, and that's been working for me. I don't know if that's going to work for everybody, but I just don't want you to be prescribed things you don't need or buy things you don't need. And I'm just trying to warn us all that that's a possibility. So just trying to help you. If you're like me and everybody else, you live on a budget, you work hard for your money, and I don't want you to waste it. So please consider those things when going on your journey. Let's all have a good journey together, and let's stay a community, guys. This has been fun. This is working. This is why I made this channel. These comments, these tips, these questions, this advice, I hope it's helping you. You guys have been helping me too, and I really appreciate it. Thanks for all the subscribes, by the way. Wow. I'm up to like 400 and something now. You guys rock. I appreciate it. And guess what? As those subscribes go up, my love goes up for all of you guys too. Just look at all those numbers going up and all that love. Thank you guys. Please don't forget to hit that like button as well, and also visit my channel, guys. I have lots of other videos. See? Have you seen them all? Check them out. I make them to help you, and I hope that's what they do. God bless. Peace.